I would like to discuss as well this paper on the reduction of the risk of secondary progressive multiple sclerosis in patients who were treated with cladribine in the Clarity study. As you know very well, cladribine is an oral medication for multiple sclerosis. Cladribine selectively depletes lymphocytes, and cladribine has a minimal effect on the innate immune cells. So in the Clarity study, quite a large number of patients were studied. 433 were treated with cladribine, and 437 were treated with placebo. All these patients had relapsing remitting multiple sclerosis. So the progression of to secondary progressive MS was not recorded, was not a defined outcome of the trial. So these authors, Patrick Bermish is the first author of the paper for the CMSC 2020. They used a number of combinations between confirmed disability progression and also confirmed progression of functional systems, mainly pyramidal, just to define a sort of secondary progressive MS. It's like a proxy of SPMS. So overall, if just to be short on this, the proxy SPMS progression was seen in 6.7% of cladribine-treated patients versus 13.5% in patients treated with placebo. So it's quite a difference, statistically significant, by the way. So and then if we split the patients in two groups, those with a baseline EDSS of 3 or lower than 3, and those who had an EDSS baseline of 3.5 or higher than 3.5, the differences are still there. So just to give you some numbers, in patients with a baseline EDSS of 3 or lower, proxy SPMS progression occurred in 3.5 versus 7.7 in the placebo group. And in patients with a baseline EDSS of 3.5 or higher, the numbers are 12.2% in patients with cladribine versus 22.4% in patients with placebo. So you can see the difference between patients treated with cladribine versus placebo in relation to this proxy SPMS concept or outcome. Also, if we look to the to patients who reach an EDSS of 6, which is quite a high degree of disability, the difference was there. So I think in conclusion, the risks of progressing to SPMS using a proxy, this was a post-hoc analysis, of course, within 2 years of treatment in relapsing remitting MS, cladribine versus placebo, are significantly reduced in comparison to placebo. And this is independent from the baseline EDSS, which I think is positive data, and it's a good piece of information, again, to transmit to our patients. The question here is always the same. We are now using anti-inflammatory drugs to treat patients with relapsing remitting MS. Only one drug has been approved for the treatment of SPMS, and only one drug has been approved for the treatment of primary progressive MS. So for all the other drugs, I think it will be very difficult to run an SPMS trial in many of these drugs. So it's very nice to analyze in a different way the data we already have and identify if there is any signal of efficacy in reducing the percentage of patients who develop SPMS. I think that's the main message coming from this study.